Now that you and your healthcare provider have decided to start FASENRA, there are a few things you should know. FASENRA is given by injection, and it requires specific storage, handling, and transportation. For these reasons, you can't fill your prescription at your neighborhood pharmacy. It will be filled at what's called a specialty pharmacy. The process for getting a prescription filled by a specialty pharmacy is different than getting a prescription filled by your neighborhood pharmacy.
Melody, now that we've decided to start you on FASENRA, you can either receive your injections from a healthcare provider, for instance, in my office, or you or a caregiver could administer FASENRA at home after receiving training from a healthcare provider.
Oh, so I can take FASENRA myself at home? That's really convenient.
Yep, you can take it at home after receiving training.
First, your healthcare provider will contact your health insurance company to get your prescription approved. Your insurer will review your benefits and coverage.
This may take a bit of time to complete. Your insurance company and my office may need to confirm some requirements to get your prescription approved.
I see. How long does it usually take?
It may take a few weeks.
Okay, that's good to know.
Once this is complete, you should expect a phone call from your insurance company to confirm your approval to walk you through your next steps. During this call, you'll receive important pieces of information, such as the name of your specialty pharmacy and their phone number.
I'll put those in my contacts.
That's a great idea. That way, when they contact you, you'll know who's calling. It's really important that you take this call. If for some reason you miss it, please return the call as soon as possible.
Okay, I'll definitely keep an eye out for it.
Either your first prescription will be shipped directly to your doctor's office, or alternatively, it will be shipped to your home. The specialty pharmacy or your doctor's office will confirm this location with you.
If your first dose of FASENRA is sent to your home, please contact either the specialty pharmacy or my office to discuss.
All right, I'll make a note of that.
Also, and this is important, if your FASENRA is shipped to your home, please refrigerate it as soon as possible, and be sure to store it in the original carton unopened until you're ready to use it.
Okay, I'll put it in the refrigerator right away.
The box you receive will contain ice packs and other materials.
Most patients receive their first injection of FASENRA at their doctor's office. Either I'll administer the injection or I'll train you on how to self-administer the injection at home using the FASENRA pen. Any questions or concerns?
Sounds like I should expect a call in a few weeks from a specialty pharmacy. And if I'm taking FASENRA at home, I should give them my home address for direct delivery.
That's right. Remember, this process usually takes a few weeks, but timing may vary. You can always call my office for updates.
In addition, FASENRA has a support hub called FASENRA 360.
Call them to check on what support services you may be eligible for, such as the FASENRA $0 savings card.
So they'll be able to help me with questions I have about affording my FASENRA?
That's right. And they can also help with kits for traveling with your FASENRA pen, a disposable container for needles, and more.
Oh, wow. I didn't even think about those things. That's good to know.
Now, let's get started.
Thanks again, Doctor.
FASENRA is an add-on maintenance treatment for patients 6 and older with severe eosinophilic asthma. FASENRA is also approved for the treatment of adults with eosinophilic granulomatosis with polyangiitis, or EGPA. FASENRA is not for sudden breathing problems. FASENRA may cause allergic reactions, including anaphylaxis. Get help right away if you have swelling of your face, mouth, and tongue, or trouble breathing. Don't stop your medications, including oral steroids, without talking with your doctor. Tell your doctor if your condition worsens. Headache and sore throat may occur. Tell your doctor if you have a parasitic infection.
How do I store my FASENRA pen?
Store FASENRA in a refrigerator between 36 to 46 degrees Fahrenheit in its original carton until you are ready to use it. FASENRA may be kept at room temperature for a maximum of 14 days. Once brought to room temperature, it must be used within 14 days or thrown away. You are encouraged to report negative side effects of AstraZeneca prescription drugs by calling 1-800-236-9933. If you prefer to report these to the FDA, call 1-800-FDA-1088.